We're glad you could join us today. My name is Marie Yambo, and of course this is Health and Lifestyle. Our social media handles at Marie Yambo, at KBC Channel 1 on X, KBC Channel 1 TV on Facebook. We are also on YouTube. Coming up in this program, prolonged use of computers and phones, the cause of joint pain, healing from within, transforming pain management using the body's own regenerative cells. And on Good Practice, we share tips on how to prevent joint pains. A dedicated social media manager, Cecilia spends countless hours behind her computer, crafting posts, managing campaigns, and even engaging audiences online. But the long hours and constant bending over her desk started taking a toll, leading to persistent shoulder pain that made each workday more challenging. While determined to find relief, Cecilia began exploring ways to manage her pain. The solution was stem cell therapy. Let's take a listen. For Cecilia, a social media manager who spends hours each day at her desk, shoulder pain became an unwelcome part of life, a persistent ache that seemed impossible to shake.
So last year, somewhere in August, I noticed that my wrist was in pain, and I didn't seek any medical attention, but I realized because I still need to work, if I place my entire hand now on the table, I will get some relief. Now, unknowingly, I now unfortunately affected my shoulder, which I noticed after two weeks, and that is when I sought medical attention. I then went for an MRI. That's when I was told that I have something called bursitis. So I have fluid in between my joint. I have more fluid than there needs to be, and I have a slight tear.
The daily struggle with shoulder pain was affecting her work, her focus, and her overall quality of life.
Pain can be very debilitating because your output even at work reduces. It got to a point where I could not even drive. I used to drive with one hand. Sometimes I would even have to take painkillers to even sleep. And it got to a point where even I didn't have to be working to feel the pain. Even when I'm just seated, it's just a lot of pain.
No matter what she tried, the pain would come back.
At first, I started with painkillers. I was given steroid injections. I tried therapy. They all could not. They could work, yes, but for like a month, and then the pain would come back. Because normally, what they would tell me is to take some rest, and I can't afford to do that.
But after months of struggling with limited relief, she tried stem cell therapy.
I got to share with Dr. Ashni that I'm having this pain. This is what I have tried. And she suggested that why don't you try stem cell therapy, where basically you take growth factors from your own body and your body basically heals itself.
By using a patient's own stem cells, it targets the source of pain directly. The process begins with a sample of the patient's own cells, which is then concentrated in a lab and injected into the area experiencing pain.
It has really improved. I have just done my third therapy, and as you can see, I can even work. It's not painful, even the experience is very manageable.
Patients can often resume daily activities within days and usually begins to notice gradual improvement over the next few weeks.
We have done two therapies before. She said that it's going to take 3, and I can't say that I would get immediate relief, but after two days, the pain would go completely.
Stem cell therapy is more than just a treatment. It's a chance to reclaim their lives. She also learned that proper posture is essential in preventing joint pain, reducing strain on the joints, and minimizing wear over time.
I used to work from the house a lot, and I even have a station, I have a desk, but it's comfortable to just sit on the couch and work from there as you're watching TV. And that I have learned and I regret, because like I have been told by my doctor, even leaning on your side like this, especially when your joint has been overworked, it can put extra tension on your joint that is not necessary and can make your condition worse. It's also good to be getting up as you're working. Don't just sit the whole day. Get up, change position, do something else. And then we are usually on the phone a lot, especially in bed and you're in one position. These are just things that make it far much worse. I've learned now things that, as you can see, even now, I'm not leaning on this side of my shoulder because that is what would be comfortable for me. So I've learned how to just make better decisions for myself, and also I learned to get up from the couch and work on the desk as I should.
And on public opinion on Word on the Streets, well, Kenyans share with us how they managed, especially chronic pain.
I've ever experienced some joint pains. Let's say when I've slept on the bad side, I always have some pains on the neck, and yeah, I use like oil to do some massage along the where I'm getting the pains. Yeah.
I've never experienced any, but I had a friend who had that problem. The only we advised him to go to first check to go to the hospital, then explain the matter to the person concerned, like a diagonist, a doctor that is. Then after that, he also persevered that, and he persevered the journey. And today now we are proud. He's doing it good.
I've experienced it when I was younger, when I was in primary school back then. I never knew what it was at that time, but I used to, you know how parents can be, oh, a lot of medicine is not good for your body and everything. So yeah, my parents used to recommend me a lot of camel soup. Yeah, and it got better with time, because right now I rarely experience that. Yeah.
Nishai experience hiyo pain. Kuna matime nikitoka kazini nasikia nimechoka. Kuna matime pia nikilala asubuhi naamka nikisikia vibaya sana. Lakini sikuenda hospitalini. Nilikuwa nafanya mazoezi. Naenda hapo kwa ground nakimbia. Saa zingine pia naenda tizi kidogo. Ikaisha tu.
We take a short break for now, but when we come back, we'll be looking at how stem cell therapy is helping in pain management. Welcome back. Imagine managing pain not just by masking it, but by healing from within. Now, stem cell therapy is a groundbreaking approach that's transforming pain management using the body's own regenerative cells to repair damaged tissue and reduce inflammation. Dr. Ashley Malde explains. Thank you once again, Dr. Ashley. Today we talk about pain management in as far as stem cell therapy is concerned. But before we even talk about how the therapy helps in pain management, we would want to just understand what causes pain. I mean, all of us from time to time, we've felt pain in one way or another, but what causes pain?
Okay, pain comes from trauma, and trauma could be anything. Trauma could be having an accident, and then you suffer from pain. You could have surgery and suffer from post-surgical pain. You could suffer from muscle tear, ligament tear, a fracture, or just some sort of damage in any body part and suffer from pain. When we do stem cell therapy, we're generally most of the time treating chronic pain. When I say chronic pain, I mean long-term pain. Maybe you had an accident in 1991 and you suffered from pain because you may have been treated, you may have undergone surgery, may not have, just healed automatically just like that, but then suffered from pain for that. So we help to treat the pain and manage the pain with the stem cells.
So essentially what you're saying is whenever we experience pain in a certain part of our bodies, could there be a degeneration of something within that area that causes you to have pain?
Not quite, only if it's chronic. What I mean by chronic is long term. And then if it's long term pain, then yes, you've suffered from something which is causing degeneration. Degeneration means that you could have muscle loss, you could have tissue loss, you could have tissue tear, you could have cartilage loss, anything, and that's why now you suffer from the pain.
So how does then stem therapy comes in to manage the pain?
So we basically inject stem cells in the area of pain. I'll give you an example. We help to treat osteoarthritis. We've all heard of osteoarthritis. Arthritis is the pain in the knee most of the times. And this is patients either suffering from degeneration of the fluid that is in between the joints. And so because of that, there's now pain because there's friction of the bones. Once the bones start having friction, the muscles around and the ligaments around start overworking themselves. And when they start overworking, there's degeneration of the muscle as well. And so there's more pain. So we inject the growth factors or the stem cells in and around that area to allow regeneration of the muscles, the ligaments. It doesn't really regenerate the intra-articular fluid, which is the gel in between the joints, but it helps to mimic it, which means it will behave like the intra-articular fluid. And that's why we see 90 to 100% reduction in pain, because now we've regenerated everything around that area.
How many treatments, if I may ask, does somebody need? Or is it permanent for that matter? Or is it something that will last for a certain time and then you'll have to come back again for it?
With our growth factors, it's standardly 3 treatments. 1 treatment every month for 3 months, whether it's hair, skin, or even pain management. But often I see most of my patients within 1 treatment are completely pain-free. That's how miraculous the treatment is. Some of my patients don't even come back for the second one because they're completely pain-free. But a dose is a dose. If you finish the 3, I've seen patients who haven't come back to me for the past 5 years, 6 years now. However, we tell them, at least after a year or 2 years, come back for 1 maintenance, because you have to maintain everything in the body. And so you can just do 1 session every year or 2 years just to maintain, so we don't have a relapse of pain. But I've successfully had patients for about 6-7 years now who have never come back to me even after just 1 session.
So you've talked about osteoarthritis, but who else is at risk of suffering, can I say, joint pains for that matter?
Joint pain is generally just age, unless you've had an accident where your joint was injured. But it's mainly age or mainly wear and tear. So we're even talking about, say, joints in the mouth. We do have patients who suffer from the TMJ disorder, and that's still that's a disorder or a disease of the joint there. So it's degeneration because of maybe something that's wrong in the body, not specifically the face joint, but just saying. So anybody could suffer. Maybe somebody who's gone through an accident and broke their bones or had, trauma to their joints. Maybe somebody who's gone to the gym, did overlifting with the weights, or didn't have a trainer who was training them, tore their muscles or, snapped their neck, something like that. They're at risk as well. Patients who undergo surgery and then suffer from post-surgical pain because the muscles or whatever has not regenerated around that area. So I wouldn't say these are the people who are at risk, but these are the people who we can do the pain management for.
Are there certain lifestyles, for instance, that can actually predispose somebody to suffering some form of pain?
Definitely majorly occupational hazards, that's what we call them. Somebody who's sitting at the desk constantly, who's constantly on the laptop, is going to have pains at the joint, at the elbow. Somebody who's probably working, say, in a bakery, who's bending down constantly, is going to have back pain. We do have a lot of chefs who come to us because of the way they're standing constantly the whole day, or bending down, or overworking themselves cooking. They suffer from back pain. We do have dentists who come to us because of sitting on the chair and bending down to look into the mouth, come with back pain. So yes, occupational hazards.
Yeah, I'm asking that because probably you could talk to the ladies especially. We're the ones who carry handbags most of the time. And our handbags can have as many things as we can fit into it. And sometimes, I think I've also experienced that, where you feel like your shoulder, especially the side of the hand that you're always carrying a handbag with. Maybe you could speak to that and just advise on how you should be able to manage your, can I say your handbag, or how you should be able to, make sure that you're not hurting yourself.
Okay, it's hard to say that. My bag myself is 20 kilos right now as we speak. But yes, try and shift your bag from shoulder to shoulder. Try and carry light. I know standardly you're supposed to carry a backpack when you go to work, but we don't want to do that. We have our Fendis to carry, so it's hard to walk into office with a backpack. But that's why balance of the weight. Try and do this shoulder and then move to this shoulder. Try and avoid, put it down somewhere where you can. Maintain your posture. Because your bag is heavier on one side, don't stand this way the whole time. So be alert. Try and stand strong. Exercise yourself. But once you've carried your bag to the office, you immediately sit down, get into another posture, damaging yourself even more. So exercise is key. Maintaining your diet is key. Maintaining your form and posture and weight is key. But all these things, all said and done, it's natural that we should understand some of these lifestyles that we need to maintain.
Thank you so much, Dr. Ashley. Unless there's something we've not touched on and you feel like you need to talk about.
I'd just like to say that I'm not an orthopedic surgeon or a pain management specialist, so to say. I only help my patients who come in for other treatments to help with the pain, only because I've specialized in stem cell therapy. But I would urge a lot of patients to seek advice even from specialists, where we're trying to educate specialists to use these kind of treatments on patients. There are patients who can't afford surgery. There are patients who are not candidates for surgery because they're too old, they're too young, maybe some conditions in their body. So there is an alternative rather than being on painkillers all your life. Don't depend yourself on painkillers. When I do the treatment for my patients, and you'll see that when in one of the episodes, that I put my patients off all painkillers, no matter even if it's tramadol or even morphine for that matter, because we want to help regenerate and make you live more naturally. So consult a specialist. Don't avoid your pain. Don't neglect your pain. There's always treatment for it, and we're trying to advance the country in terms of bringing in such treatments, just to be a pioneer in the country, so you don't have to suffer from painkillers and pain all your life.
And on Good Practice today, we share with you tips on how not just to manage pain, but also how to prevent it. Take a listen. Social media has become part of everyday life. Whether it's to connect with friends, share what you're up to with family, follow trends, and draw inspiration from other accounts that interest us. While it's easy to get wrapped up in the world of social media, it's important to recognize when we need to take a step back. So here are 5 steps we can take to develop healthier social media habits for our well-being. Number 1, turn off notifications. Push notifications play a big part in keeping us engaged with social media apps. But by turning these off, we're not easily tempted to check our phones as often. This can help you feel more in control of when you pick up the phone. 2, set boundaries and time limits. Sometimes when we're scrolling on social media, it can feel like we lose track of time. Hours can fly by before we know it. By setting some simple time limits or choosing specific times of the day for when we are on social media, it will ensure that we still have time to do other things that are important to us. So set daily time limits or reminders to take a break. 3. Clean your social media feed. It's easy to feel overwhelmed by the amount of information on social media. The algorithm is constantly serving new things that might capture our attention. Sometimes not all these things are what we'd like to see. So, unfollowing accounts that are causing stress can help build a more enjoyable experience. Instead, follow the accounts that bring you joy and positivity. This can help keep our feeds full of the things that interest us and make us feel good. 4. Limit social media time before bed. When we use or check our phones, our brains are stimulated by the movements and the blue light being emitted from the screen. Instead of winding down and getting ready for sleep, this can have the opposite effect, making it more difficult to drift off. Putting our phones down in the hour before bed can reduce this effect. If it's too tempting to have the phone nearby, try leaving it on the other side of the room or in another room entirely. Last but not least, focus on what you're grateful for. It's normal for people to compare what they have to others. Social media has made it really easy to do this, and sometimes it doesn't make us feel very good. To help with this, it can be useful to practice gratitude. Paying attention to what we are grateful for can help to improve our mood and be more aware of the things that make us feel good. While social media is a great tool for lots of reasons, some people can find it upsetting. And if you're finding that you're feeling upset, anxious, or stressed because of social media, it could be helpful to reach out for support from loved ones and people you trust. Also, consider talking to a counselor. We've come to the end of the program, and on behalf of everyone who made this program possible, we want to say thank you so much for your time. Of course, our social media handles at Mariambo, at KBC Channel 1, and also on YouTube is where you can find this program in case you've missed any part of it. And so until next time, goodbye for now.